Hi, the young fellows. You are going to be a physician in near future. That is our community. Me, Dr. Tabarok Ullah Chowdhury, a former retired superintendent, modernized Sadar Hospital, Feni, former General Secretary, BMA Feni, former General Secretary, Diabetic Hospital, Feni, and Member Secretary, Feni University Trustee Board. Now I welcome you all in the session, A Guide to Hospital Management. Probably all the medical graduates called it is a dry subject. So it may not be interesting to some of you, but this is most essential part for health and health management. So I welcome you again in my session, A Guide to Hospital Management. Can I have the slide? Before going in details, though everyone, we know our from general conception, what is health, what is hospital, what is management. But when we are going to elaborate it and discuss it in a forum that requires a definite scientific presentation and definite definition in that way. So first of all, I would like to explain or define a hospital. Just you saw what is hospital? A hospital contains staff, doctors, and so many. Definition of hospital, it is an integral part of our social and medical organization, the function of which are to provide the population complete health care, both curative, promotive, and preventive, with outpatient services regarding out of the family in its own environment for achieving a common goal of patient care through a hierarchy of authority and a responsibility through managerial process. So hospital is, the hospital not only a medical organization, it is also a social organization. That is the basic concept which we previously didn't have in our mind, that is it a social organization. So we are discussing hospital. In our situation, there are so many types of hospital. In third world country, where like Bangladesh, Pakistan, India, Sri Lanka, Indonesia, where the hospitals are classified primary level hospital, secondary level hospital, tertiary level hospital, and a specialized hospital, that is infectious hospital, cardiac hospital, mother and child hospital, so on. This is one sort of classification. And another sort of classification is there, that is government hospital, private hospital, NGO-based hospital, public-private partnership, which contains no profit, no gain. In this way, this sort of hospital, example are Bardem Hospital and Heart Foundation hospitals. These are public-private concept. So we can classify it in hospital in different way. The primary level hospital, which are located in the village or in the remote area, where basically outpatient service is given. No investigation facilities, minimum either diabetic or sugar, this simple test, hemoglobin test, this may be done in primary level hospital. But which is the most vulnerable people comes in the primary level hospital. Then the secondary level hospital, in our situation, that is in Bangladesh or in Pakistan, it is in Bangladesh it is called Upojela, somewhere in sub-district. That is the secondary level hospital where curative, preventive, and all sort of health care delivery systems are concentrated, where there is a consultation by the major subjects and some sort of operation goes on there. Then comes to the tertiary level hospital. It is generally in Bangladesh, it is called district level hospital, or like other countries, it is tertiary level hospital where referral patients comes from the primary and secondary level, and it is equipped all the departments required for patient care. The fourth is the specialist hospital, which is kidney hospital, cardiac hospital, this is like this chest disease hospital, neurological hospital. These are a specialized hospital. So from the periphery, the patient comes from primary level to the secondary level or to the tertiary level, and then from tertiary level to the specialized hospital. In other way, in the government hospitals, in some Bangladesh and others third world country, it is a total free of any revenue, no pocket money usually have to be expended in the government hospital. The private hospitals, which are the corporate hospitals, usually now the whole world is running by the corporate business, and second, private hospitals are growing very fastly by the authorities, and which are nowadays very, very well equipped, well manpower placed, well cleaned, but it is highly expensive, especially people like third world like ours is not acquainted to go such big private hospital. But district level and others hospitals, these private hospitals are less costly, but people are now rushing to the private hospitals due to so many causes. Thirdly, the NGO hospitals. These are the hospitals where non-government organization voluntarily gives the services, taking the money from the different sources, and services to the patient are totally or almost free of cost. Then the fourth, public and private partnership hospital. These are non-profitable organization, but they are giving the service very efficiently and effectively. For example, diabetic hospitals in different districts and centrally burden hospital in Bangladesh. Heart-founded heart patient and eye hospitals, these are all public-private partnership, and here patients have to pay for their services, but it is not like the corporate hospital. Here the amount expended by the patient is less and services up to the mark. So we can just, up to this, we can clarify what is hospital, what are the types of hospital. But the hospital, why a hospital is needed? A hospital is needed to ensure health. What is health? As per World Health Organization, health may be defined as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. But recent World Health Organization and the social reformer thinks that this is not complete. The two terms wants to be included in health definition of health, that is spiritual health and economic health. If a person is economically unsound, his mental health cannot be achieved. And spiritual health, that is a big chapter, and if spiritually you are not sound, then you cannot get a mental peace or healthy health, which we defined as health. So in future, World Health Organization is thinking to add economical and spiritual well-being also. Now, we know health as a definition is like this, but there is another thing, that's public health. There is a difference between health and public health. What is public health? Public health has been defined as the science and art of preventing diseases, the prolonged life and improving quality of life through organized efforts and informed choice of society, organization, communities, and individuals. That is public health. It differs from the health in different way. World Health Organization once decided, a slogan was given in 1978, health for all by 2000 AD. That is a global slogan, health for all. How that could be achieved? Public health concept deals with that one, how to achieve health for all. Health for all, as defined by the World Health Organization, is achieved by some points, especially the primary health care is the concept that was taken by the World Health Organization, by which public health and the health can be achieved. Primary health care is a care for all, at all ages, all people, everywhere, deserve the right case, right in their community. That is, the people will stay in their community and they will get their health services nearer to him in the affordable price. That includes preventive health, that includes curative health, that includes health education, that includes family planning, that includes immunization, health education, sanitation. These are the components of primary health care by which public health can be achieved as think by the World Health Organization. So we will emphasize public health as a managerial part of the Facilitator. The public health is the basic concept how the people gets their health service from the authority. Now, I will tell about hospital administrator. Now, the public health and the hospital management, it includes, it has been delivered by a system and a manager, which is called the health administrator. Hospital administrator. Hospital administrator is responsible for organizing the health services and daily activities of hospital, management of staff and budget, communication between departments to ensure adequate patient care. Then hospital administrator, that is a manager. What is his duty? Hospital administrator is responsible for organizing for health services and daily activities. Health services, daily activities of the hospital, management of the staff, budget, communication between departments to ensure adequate patient care. Our final target is the patient care, and it is in institute, that is the hospital, and which is guided by an administrator. What are the roles? There is a difference between a manager and administrator. A manager, who is manager? A manager, a person who manages. That is a person who performs the duties with allocated resources within the time frame. The desired effect or goals have been achieved by a person, which is known as the manager. Manager have to perform the duties with his allocated resources. Resources means man, money, materials within the time frame and the desired effect. In our situation, what is the desired effect? That is treatment, cure of a patient. So, a hospital administrator has its function in 4 you see table 1 and table 2, just 2 broad heading. What? How a manager or administrator provides the services. What are the services? If I think a corporate hospital, then there is a board who manages it. Board put his all responsibility to administrators or administration. We are thinking in 4 ways. What services is essential in a hospital? First, informative service, therapeutic service, diagnostic service, support service. If we classify all the activities performed in a hospital, in a situation, this 4 headline includes almost all the essential parts that is essential for a patient care. Information service, first of all, It is concerned with admission of the patient, billing, medical records, computer information, health education, human resource management. This is informative submission, information services. What is admission? If a patient desires to take his treatment from an institute, he have to be admitted, if not outpatient department, he have to get his admission, and is a long process which requires some recordings, which department the patient have to be go, when his operation or other thing have to be done. All the information are given at the desk of admission. The second thing is billing. It is very important for private and corporate hospitals, where the corporate hospitals is just waiting for bill. So this is a very big department where bill for bed rent, bill for diagnostic facilities, bill for medicine, bill for consultancy, all are in separate headline. But this department maintains all the bills regarding expenditures that have to be expended by a patient in the billing section. Thirdly, the medical records. What are the medical records? Records after admitting a patient into the hospital and discharging from the hospital. In between, what are going on, everything have to be recorded. Nowadays, it is very easy, as there is a computerized system almost everywhere. So medical records, his history, his previous history, his diagnostic records, his judicial records, if whether it is a judicial, that is, if it is any sort of injury, any sort of indecent assault, any sort of sexual violence, and so on. These records is very, very important. If records have been kept, once it was kept in different volumes and volumes in a store, now everything can be done in a single desk by a computer. So medical records are most important, and these are the function or job of an administrator to maintain all records by proper personnel. Then the computer information, just as I before told you, that the medical records, not only the medical records, all sorts of information is preserved in the computer for future reference. Its billing or anything else, total is computerized nowadays. So without computer or IT personnel, a hospital cannot run nowadays. So a administrator should be well equipped with computer literacy. Nowadays, without computer literacy, an administrator or a manager cannot run a hand tab. So they have to be well equipped with computer. Then health education. You see, gentlemen, health education is a vast arena. We are now passing a very pandemic situation worldwide. So the part of health education is now working totally. The information should be concrete, The information should be close-ended. The information should be specific. Health education refers in this way. Just example, now in this stage of pandemic, we are for COVID-19, we are telling three things. It is in electronic media, it is in printed media, it is by the health authorities. In every aspect, we are telling three things at least. Mask is mandatory, hand washing is mandatory, and social distancing. This is a information through health education. This is not essential that a medical person will give the health education. Any social element can perform this health education, and it is coordinated by the health administrator that the information should be authentic, should be close-ended, and should be precised. In one section of the world, should not give other sort of information. So short information from who it disseminated to all the countries, to all the communities, to all the primary health setup, the same information, three things. It is just an example which you are running now. In any sort of this, especially school health, which is a part of health education, where the kids are trained how to be hand washed, how to go to for sanitation, and so on, how to nail cutting. This all includes in the health education, especially the sanitary activities, cleanliness. These are the part of health education. It is the primary duty of a health administrator to health educate in the community. Then comes to the human resources. This is a big challenge nowadays. Without job satisfaction, that may be a ward boy, that may be a sweeper, that may be the consultant. Without job satisfaction, he cannot give the service to his whole length. So, an administrator defines, he makes the hierarchy, he makes the human resources for job satisfaction, for his salary, for his promotion, each and everything. This is a managerial part. Nowadays, in corporate business, BBA, MBA, these are the subjects which are very popular, but basically they concerns with the human resources, economic resources, financial management, these chapters. But human resource management is very critical for medical side, as the personals are in different categories: doctors, nurses, mid-level managers, ward boy, technical personals, IT personals, so many. So equilibrium in them is very tough job, and it is done by the administrator. This includes our information services. Next, come to the therapeutic services, which is the basic part, treatment of the patient. OT management, speech management, lungs management, respiratory therapy. This all the medical personnel we know is the basic thing. It is everybody in the medical, all the medical graduates we know what is patient service and speech therapy. In addition that, pharmacy is a very big chapter, very big chapter. In a hospital, where a pharmacy, what the medicine should be there in daytime, what should be in the emergency time, what should be in the night time, how many manpowers have to rise, where shall the pharmacies have to be located. All these are included in the pharmacy department, which have to be guided by the administrator. Nursing, this is a vast department, and nursing supervisors are mid-level managers also, and some situation, especially the ICU and the OT, there are some jobs which cannot be done by all nurses without a special training, as it is true for also a doctors. We may be a medical graduate, but without practically handling in the ICU or in the OT, we cannot be a perfect physician or a perfect nurse. So nursing department, their roster maintaining, their distribution, these are very important, which have to be monitored every day by the health administrator. Then the dietary section, it is another chapter, and without food, without nutrition, especially the diabetic patient, the kidney patient, the hepatic patient, it requires a special diet. So when we are going to appoint a vendor, the administrator have the knowledge how many patient requires, what sort of nutrition, what should be their diet. So this is a very big chapter, and an administrator have to look after all the things. Now come to the diagnostic service. Once we have any diagnostic facilities, just clinical eye, history examination is the only tools by which we diagnose and treat the patient. Nowadays, without diagnostic service, a medical personnel cannot think even to give a simple treatment proceedings, as there is so many legal issues come forward. So if we are sure that this is the diagnosis, even then we have to take a medical laboratory support for that one, especially the medicological cases. So diagnostic service is a basic part for a hospital administrator to set up all the things. Diagnostic service includes medical lab, radiology and imaging, nuclear medicine, emergency, cardiology, neurology, everywhere. Without diagnostic service, it cannot be put a step for any sort of operating procedure or any sort of therapeutic proceeding. Without diagnostic service or medical lab, radiology or nuclear medicine, we cannot proceed ahead. Then come to the support service. It is totally a job for an administrator. Central supply, the selection of a vendor, when the supply should come, in which department requires which articles, everything have to be calculated before as per budget, then it is goes to the central store, and store management is a very big chapter. You have to know first come first serve or first entry last serve. There is FIFA, FIFO, and so many rules. The central supply depends on that one. So for example, I have got some paracetamol in a bulk. This a batch whose expiry date is very nearer. So an administrator knows its date of expiry as he ordered the vendor to give this medication, and central supply and a store will give the information that this batch, medicine from this batch should be distributed earlier, or this machinery should be distributed earlier. So a administrator have a keen knowledge regarding the store and the central supply. Then come to the biomedicals. Bio means life, medical includes physics, chemistry and biochemistry, molecular biology, everything. Initial level hospital or others where research is the basic fundamental tools, and biomedical department is well equipped with and the medications which are essential, which researcher requires each day. And without a biomedical department, research activity in the medical fields cannot go ahead. A newer medication, and at present in the pandemic situation is going on in the whole world, and COVID-19, we are thinking for vaccination, and the animal where you are pushing this is in biomedical department, from where you are getting your animals, robot, rabbit, or sheep, or monkey, whatever else. Everything is under the control of biomedical division. Now come to the housekeeping. What is housekeeping? It is an integral part of the hospital. When we are stepping in a hospital, we just look whether it is clean or aseptic, or there is well managed in the veranda or in the lawn, where all the trees, plantation, gardenings are going on. When stepping in the hospital, the cleanliness, the bed preparation, the diet supplementation, and setting of the beans. As we know, for discarding the extras, there are 3 sorts of beans: red, yellow, and black. For sharp cutting weapons and dangerously contaminated materials are discarded in the red baskets. The yellow baskets which keeps the liquids, the excreta from the aspiration or vomits, etc. That is the fluid drawn from the body, are kept in yellow basket or yellow bean, and black bean which are meant for general waste, that is plastic or the nut or others. All the general products are kept in black beans. So housekeeping is a key for a administrator to look after for the patient satisfaction. When a patient enters into a room, into a bed, if it is clean, if it is safe, if it is well placed, then he mentally satisfies. And these are the things done by housekeeping department. Maintenance, you know, each and everything, our electricity, our plumber, and all our things. Maintenance is a very essential part. Day-to-day activities requires some maintenance for all electromedical devices, for all household devices, everything. So is the maintenance. Then dietary, it is also, as I told before, the dietary section, when the food have to be purchased, when the vendor have to be collected, when his bill have to be given, what are the diets that have to be maintained previously, and everything related with the administrator. Then transportation. The ambulance is not the only transportation, but there are so many transportation there for which requires for well maintenance of a hospital. These are in nutshell what an administrator have to be done in a situation where there is a big hospital. It is generally, it lies on the secondary and tertiary level hospital. It does not require in the primary level hospital. Especially the corporate hospitals are well equipped, well planned regarding these format of distribution. Now, can I see the table B? Yes, this is the same. You see board of directors, that is if it is a autonomous body, or if it is a tertiary level hospital, if it is a public private hospital, then board of directors or the executive committee is the headed. They are responsible for guiding, for development and allocation of the budgets. The remaining, all the things which the board or the executive committee does has been performed by the administrator or the president of the board. He appointed therapeutic service center, a person, a vice president or a manager in a some middle managers for therapeutic center, for pharmacy center, for nursing center, for dietary center. Accordingly, a manager, mid-level manager is there for radiology center, for cardiology center, and nursing neurology center. And for administrative service, there is a manager who facilitates, facilities can be created by him, information center, admission center, human resource center. Then financial services, which can be billing center, budget and planning, accounting, payroll service. service, in that case, emergency preparedness, clinical emergencies, facilities and planning, safety, hospital safety, safety of the individuals, so on. In that case, there are also some points for disaster management and hospital strategies. This is in brief Can I go for managers? Manager in that case is responsible for patient care service, act number. Number 2, legal and statutory responsibility. What is statutory? Statutory means vidhibadda, lawful, legal and lawful responsibilities. Maintenance services, logistic supplies, ethic and code of conduct for staff, patient, relatives and visitors. It is very important, gentlemen, you think ethics not only for doctors, ethic and code of conduct for staff, for patient, for relatives and visitors. Everywhere, everybody concerned should have some code of conduct. Otherwise, a hospital environment cannot be peaceful. Hospital safety, which is very, very essential in our situation, our staff and our doctors feel unsafe. That is the responsibility of the government and responsibility of the manager to communicate with the government or in the politician to make an environment which is safe. Come to the quality management, not only the management, but the quality full. We are treating 1,000 patients in our situation, and in outdoor, we are giving service to 200 to 300 patients by a medical officer. The question arises whether it maintains the quality. So the manpower distribution and the service is reciprocal. So for having a quality management, the manpower, logistic and resources distribution should be in equity. Planning and decision making. We are trying to expand our services, to extend our building, to extend our facilities. In that case, we required 3 things: man, money, materials. For achieving a goal, these 3 things is very essential. Without the combination of 3, we cannot achieve the goal. Man, in our situation, it is an universal definition, man, money, materials. For any sort of activities, in any sort of goal achievement or any sort of outcome to have be achieved, these 3 things is essential: man, money, materials. In our situation, man is in different categories: super specialization, super specialist, a specialist, middle level doctors, managers, nurses, medical technologists, paramedics, housekeeping workers, and so on. So in a situation, the proper selection of man, proper qualityful man, proper quantity of man is very essential for healthcare delivery system. It generally should be in a pyramid. That is, top will be the super specialized person, or on them is the manager, then the medical graduates, and so on, and the last the cleaners and others, that is MLSs and so on. So that should be a pyramid. One doctor, 3 nurses. But in third world country like Bangladesh and others, this manpower distribution is not proper. So healthcare delivery system usually hampers in government situation. But in private or corporate hospitals, nowadays it is mentally well. The second comes to the money, which is the basic thing for all. If you have money, you can purchase man. If you have got money, you can purchase the materials. But money should be allocated as per desired to have the desired effect. In our situation, what is the desired effect? We want to have a patient care. A patient is coming, is out from the hospital with his satisfaction, he is cured. So money distribution from purchase, from the health worker should be in equity. Then comes to the materials. In our situation, we have to be very careful about the materials. What the infrastructure, what the materials requires in the infrastructure, how many money will be allocated for infrastructure, what will be the for instrument and others, what for pharmacy, what for the research. These metals required have to be identified fast, and later on it have to be distributed as per requirement. In other words, to achieve a goal in a hospital situation, for a manager, he requires planning, organizing, staffing, directing, controlling. So we can define a manager in different way. A health administrator is a manager. He have the adequate knowledge of planning. He have the adequate knowledge in organizing. He has adequate knowledge for staffing, for directing all the staffs and controlling the whole situation, not only the staffs, but the total patient and the relatives and the society. So to achieve the goal, a manager have the knowledge, skill and attitude. What is our goal? Our goal is to treat a patient, to treat the society, to have a disease-free environment in the total situation, and that is can only be achieved by a manager who have skill, who have a knowledge, who have an attitude. You may have skill, you may have knowledge, but if your attitude is not proper, then you cannot achieve a goal. Unfortunately, I have to say, the medical graduates, they always think that their skill, their knowledge is up to the mark. Yes, their skill, their knowledge is up to the mark. But attitude to serve the people in the rural community or in a adverse situation, our attitude is not proper. So the goal is questioning. So for a healthy environment, for to be a skillful manager, to be a achievable goal, we should have skill, knowledge, and last of all, attitude. So it is in brief, I just give you some nutshell information regarding hospital management and public health management. These are very big chapter, and as I said before, it is not interesting subject, but it's very critical subject, and you have to deal not only with the patient, but also the society, also the politician, for achieving your goal. So, gentlemen, in nutshell, I thanks to the audience as well as to the BIMSSCON for giving me the opportunity to share some of my knowledge regarding health administration and public health. Thank you all. Thank you again. If you got some question, I can give the answer in short.